Paul LePage. What benefits and opportunities for Maine seniors do you see in the recently passed National Health Care Reform Act?
Nothing. I think the recently passed Health Reform Act is going to take $500 billion out of Medicaid, Medicare that our seniors need. I do not think we need to be going there. I think what we need to be doing is strengthening Medicare and Medicaid, not weakening Medicare and Medicaid. I find it very sad that our federal government took a program that we've watched here in Maine for several years, and we watched it not work, and then nationalize it at the expense of not only our elderly, but our disabled and the people that need health care more than anyone else. Our disabled people, our disabled vets, and our elderly. And that's where we should be concentrating, not trying to get one size fits all for all 300 million Americans. We need Medicare and Medicaid to work for our elders. And the program is going to be taking away way too much money out of Medicare and Medicaid, and it's time that we, the people of America, stand up to Obamacare.
Kevin Scott.
I haven't read the 2,800 pages of federal legislation that is called the healthcare legislation that you referred to. I can assure you that if $500 billion is being shifted around in legislation, there's a benefit somewhere for some segment. There are always opportunities when we face challenges and we move forward. I will not wholesale discredit a piece of legislation that I don't have my hands very well around. I'm certain there are some serious deficiencies in that legislation, but I cannot put my finger on them. I think the opportunity right now, so that goes to the benefits piece. I'm not 100% certain what the benefits are there, and I'm pleased to acknowledge that. The opportunities, however, are endless. What can innovative private sector, state of Maine service providers do in the face of these changes? A lot. We can get right out in front as a state and start working with our state agencies, not only the area agencies on aging, but with our Department of Health and Human Services, and start making sure that we're targeting adequate funding for those areas where we may see a change in a drop from the federal government. That's an opportunity to go forward with our own ideas and create community-oriented solutions. I will never sit back and examine a problem as hard as I examine a solution. I will never sit back and tear something down when there's a need to build something up. That is the type of person I am. That is how I got to be at this table today, and that's my position on what we need to do going forward with those issues.
What benefits and opportunities for Maine seniors do you see in the recently passed health care?
First of all, let me assure everyone that I see health care as a right and not a privilege. It is a right. I also want to talk about the federal health care bill that you asked about. When President Obama graced the state of Maine with his presence back last fall, the health care bill had just been signed. He stood up and he told a crowd, he said, it's like the farmer who plants the seed and the next day goes out and says, whoops, nothing's growing yet, it is a failure. The health care bill had just been signed 2 days before he was here. We don't know yet the full benefits, but I do know this. Seniors are going to benefit from not falling into the donut hole. I was standing in a pharmacy in Bangor, Maine, and a man came in with a slip showing how he had to pay thousands of dollars because he had fallen into that donut hole. And until he reached another threshold, he would get no more help from Medicare. Affordable health care affects everybody. It isn't just seniors. We're all in this together. If our kids and our grandchildren don't have health insurance that they can afford, then all of Maine suffers. So this is a hugely important step forward, and it says that health care is a right. But let's talk about in Maine, health care is so expensive. A lot of people have none, or if they have health insurance, they're paying so much that they really have catastrophic coverage. We have a chance now with this program to expand health insurance to everyone through the exchanges that the legislation gives us the opportunity to do, giant purchasing pools to get the cost of health insurance down. The state of Maine has been a leader in prevention, and that's for elderly as well as for working people, that we reward good, healthy behavior. Again, all of these things are encouraged in this legislation. These are things that I do support. We will continue to work to make sure everybody has affordable, quality health care, whether you're old or young.
Well, I think there was an estimate of $400 billion of waste, fraud, and abuse in the current medical system, but we decided to create the new 2,000-page healthcare reform. Why didn't we just take care of the fraud and abuse that was in the current system? That would have been a great place to start. When you look at Maine's healthcare, we have 100 auto insurance companies in the state of Maine, and you can buy auto insurance to suit your needs. We have one predominant healthcare provider. It is not a competitive situation. You know, this country was built on capitalism, competition, and we need those free market principles back in our healthcare. Give people those opportunities. They don't necessarily need the Cadillac plan, and nor can they afford it. So the more people that bail off of our current healthcare plan in Maine, it puts more burden on the folks that are paying. So another key component here is we need to focus on our youth. We're really a lot of times concerned, on our exit strategy in life, which rightly so, but we need to focus on our entry strategy as well. Keep our young, healthy people in Maine working to help supplement the folks that are getting older that have paid their dues, worked their whole life, and deserve that, boost at the end of their life, maintain their quality. So we need to I think, like a workman's comp Blue Ribbon Commission we did back in the 80s. That's what we need to do currently in Maine. Overhaul Maine's healthcare system, drive competition and choice back in there where it belongs, to give people choices, and that's what's going to give us a healthy, viable healthcare system going forward.
Well, let me tell you how we're going to do it. Because saying we need to do it is one thing and explaining how we're going to do it is something else.